Honourable member for Innisfail, Sylvan Lake, followed by the member for Calgary Mountain View.
Thank you, Mr. Speaker, and thank you to the member from Edmonton Calder for bringing this emergency motion forward. Understanding Order 30, subsection 7, there are 6 conditions a motion must meet. Clauses B through F are pretty straightforward, but as far as I can tell, there is no debate on whether this motion meets them. It does. It comes down only to meeting the first requirement, namely that the matter proposed for discussion must relate to a genuine emergency calling for immediate and urgent consideration. And as I will explain, the failure to deliver care that has arisen by the government's decision has already generated an emergency that this House must address urgently. When people receive home care services, it's not because they simply want them. People receive home care because, quite frankly, they're not able to provide their own services in their own home by themselves. So when stories emerge of missed appointments, it's not just a bad news day, it's a failure to provide the necessities of life. This government was warned repeatedly that centralizing so many home care providers in such a short period of time was not just unwise, but frankly, it was dangerous. Sadly, the government did not heed this warning, and some of the most vulnerable people in our province are now paying that price. Mr. Speaker, this is an emergency, requiring immediate debate, because the government's actions are seriously endangering people. They may try and say that the problems are limited to one single home care provider, but the stories that I'm about to tell you show that that's simply not the case. The Minister of Health would have us believe that this was limited to one company by the name of Rivera. However, that's not realistic, as we've seen story after story about WeCare, CBI, and many others. On October 10th of 2013, the Health Minister stated that he regrets the inconvenience caused by service disruptions to 300 home care patients in Edmonton. In Edmonton, the system failed, said Minister of Health, adding that Alberta Health Services' apology earlier today for the disruptions was appropriate, and he holds them responsible. One has to wonder what Alberta Health Services was doing in all of these conversations they were having if they couldn't see this coming down the track. If we go even further, we know the story of the Edmonton woman who was left alone on the floor of her senior's residence for 9 hours after her home care worker did not show up. She's 87 and has lung cancer and is failing eyesight. Her healthcare worker was from CBI Home Health, and over the Labor Day weekend, she failed to show. That 87-year-old woman was on the floor. She yelled a few times, she couldn't move, and she didn't know what she was going to do. Her family, her friends checked on her the next day. Her daughter says, "When I saw my mother on the floor, all soiled, I started to cry because I thought, how undignified for this poor lady to have to be in her soiled clothing at all times." One would say, if that doesn't sound to you like it's an urgent need or an emergency, then I wonder what is. This woman's experience illustrates the province's process of selecting new agency to provide home care earlier this year was flawed right from the start. I know the Health Minister would have us believe that everybody had lots of time and everybody participated. However, even their own report that was listed by AHS, posted by AHS, showed agencies competing for home care contracts complained about a lack of transparency in the selection process. So if the Health Minister would have us believe that these companies all had fair access, but the companies are telling you there was a lack of transparency in the process, then clearly this was not an open and transparent process, and now we have a very serious and dangerous problem facing our vulnerable Albertans in this province. Even AHS spokesperson Carol Anderson said missed visits by home care providers are an issue. Mr. Speaker, Camp Tate, as many of us know from Creekside Co-op, was told by the Premier that these issues would be addressed many months ago. He blogged about some of the shocking and extremely sad situations that home care patients were forced into. One of the things he said, more than 30 people scheduled for home care services in Leduc did not have their shifts covered just in September, and that was from WeCare. The situation at the Leduc Centre was posted online, and previous staff at WeCare said this didn't used to be a problem, but because of the shift to the way the government wanted to go, forcing them to take on so many clients in so little time, they did not have enough staff. One of their regular clients recently went an entire weekend without getting help for a bowel routine. Now, I don't know if many of you know what a bowel routine is, and I'm sure I'm not going to go into too much detail because it's not very pretty. But as somebody who was a caregiver, and I can tell you, my brother had bowel routine, and when you go a whole weekend without having somebody assist you with removing necessary bodily fluids from your skin, from your body, that is an emergency, and that is urgent. She goes on to say, Mr. Tate goes on to say, because she went all weekend without bowel routine, she became very incontinent in her bed, and she was deeply embarrassed. Poor woman. The blog goes on to say, the mental anguish of people with disability, being uncertain of personal care attendants not coming, wondering if you will get help or not, can grind a person down. It can dampen one's confidence to live in the community independently. The sad thing here is the provincial government is not paying much respect to personal care attendants. Goes on to say, AHS needs to understand the rights of the ones who are disabled and or elderly. I help people with their daily living. I hope I give them dignity and self-respect. People that are going through these issues, whether it's having a hard time growing old and all the complications that go with that, or ones suffering from disabilities and all the things they go through in a daily manner, deserve respect.
Hear, hear.
Now, Mr. Speaker, the Health Minister tells us that there was a review done on this exact issue way back in July, and he mentioned Janet Davidson, who did that review. So one can only imagine either the review was done inadequately or it wasn't done at all. These care providers have been telling this government, have been telling opposition, have been writing letters, have been in the media saying that the problems with home care are rampant, and that going from 35 providers to 10 providers was going to be dangerous and cause serious issues for people receiving that care. Mr. Speaker, these people cannot afford to wait for the government to come back with yet another report on home care services next year. They cannot afford to go another 6 months of missed appointments. They cannot afford to spend 1 minute, 1 hour, 1 day, or 1 weekend sitting in their own waste.
Hear, hear.
These are vulnerable Albertans not getting the care they need from the government. Now, I understand that the Minister of Health doesn't want to talk about this. I understand that the Minister of Health finds this conversation a bit uncomfortable. I also understand that even the Minister of Health knows that in Edmonton especially and in Calgary, this process is failing Albertans and putting them in a dangerous situation. And I would suggest to all members of this House, it's not an Edmonton or Calgary issue, folks. It's going to happen in Red Deer, Medicine Hat, Lethbridge, Balzac, Innisfell, Trochu, Fort McMurray, and many other places across this province. It is the agenda of this government to roll out centralized home care, and many of your constituents may just be calling you and explaining to you that their home care worker did not show up to give them a bath for a month. We thought a bath a week was terrible. Imagine going without a bath for a month. So when we sit there and you actually put it into perspective, there is absolutely no harm in having this debate today. And if anything, we would be doing our jobs today as legislators to understand that any time we leave a vulnerable Albertan laying in the floor and we don't address it in this House at the first opportunity, that is our job. That's why our constituents put us there, and it's our job to fight for every single Albertan in this province who can't be heard. I implore each and every one of you, put the party lines aside and have an emergency debate on home care. Thank you.